Hey everybody, it has been a while. Please accept my apologies. I've been taking care of my health for the last 4 weeks. A lot of changes going on. I've been working on many different types of social media push on the last 7 episodes I've done here on Talking Alternative Radio. And I've gotten about 350 new friends on Twitter. Thanks for reaching out to me there. A lot of you are in the alternative space, like yoga, meditation. A lot of you are reaching me through acupuncture, pharmacies, other kinds of exercise and nutrition programs. So either way, I can see that I've tried over the last 2 months to provide a platform for everyone out there to understand there are better ways to treat whatever chronic health care you have. Whether they are chronic illness or whether it is continued work and maintenance on specific medications you're taking or whatever. The bottom line is that I'm trying to provide this as a platform to continue to educate people on 2 variables that I continue to look at in healthcare. One of them is QOL, quality of life, and the other one is just simply cost. Now, today I'm going to take a different stance. It has been a while, so I've had some time to think. Now that I've spent the beginning part of this show talking about individuals and their own healthcare concerns, I decided to talk now about the employers. For those of you who are working full-time for a union, for a private sector company, for a small business of 5 people or less, everyone is finding an alternative to their health insurance or health benefits through these types of setups. A lot of people who are working for themselves or who are unemployed have different programs such as the Affordable Care Act or other kind of programs, but unfortunately it's been proven that in many ways it's not enough, or it needs a lot more support. So I'm actually taking the employer route today because I've had an opportunity over the last couple weeks to meet with various brands. I won't mention their names because of a disclaimer, but that's not the issue. The issue is that there are companies out there who are very concerned about their employees, and therefore they really offer solid dental and medical and vision programs for people out there, even covering things that you would even far from imagine. Some of them actually cover acupuncture. But the reason why I'm bringing them into play is because we're now entering another phase in our year with an upcoming election, with continued changes going on with healthcare programs, including the Affordable Care Act. And more recently, the business segment, the employer programs out there are now being targeted for restructuring. In fact, quotes are coming in for 25% premium increases in January 2017. That doesn't mean it's going to impact that fast. After all, we are going to have a new official in office that may or may not make changes to it. But in order for everyone out there to be forearmed and forewarned, hopefully over the next 4 weeks, I'm going to be able to take this tact with healthcare and inform all of you of your choices and your options that you will be in a position to make over the next several months. So I'd like to quote to you something about employer healthcare, which I personally have found over the internet. I think for those of you who want to read it directly, it is www.bizfilings.com. That's bizfilings.com. I want to quote directly what I read today. It's called, "Should You Offer Employees Healthcare Benefits?" Healthcare benefits are optional for most smaller employers, but of critical importance to most employees. Employers of all sizes should be aware of the pros and cons of offering health benefits to their employees. Most of all, these kinds of issues are to retain talent. A lot of companies out there with downsizing and other kinds of things happening in the workplace, the marketplace, are looking to retain top talent, and it seems that it's no longer the bonuses or the perks of having 5 weeks off or whatever has used to attracted people in the past. Today, it's, do you have a sound healthcare package? And the responses of recent surveys are showing 60 to 65% are preferring to stay in their jobs because of the health care protection they are receiving. It doesn't only mean insurance, it also means health savings accounts, financial savings accounts, disability insurance, Medicare support, Social Security support. But let's face it, the predominant reason why most people are employed are for their health care coverage. And of course, dental, because a lot of people are looking for some kind of maintenance on that side. So with that being said, I want everyone out there to think about the employer you work for today. Are they giving you adequate coverage? Is it something you'd like to see improved upon? Voice, if you can, to your human resources people as to the quality of coverage, and if there are concerns over what the Affordable Care Act is going to do to those companies in the near future. At the same time, I would say from my own personal experience living with epilepsy, try to get secondary coverage of your own. And that's what I've had to do. But I have found it to only serve a purpose in a gap that needed to be filled when a company would not provide it, such as my medications. You guys probably aware over the last several weeks I've talked heavily about a lot of branded drugs not being covered by insurance. I don't think that is the case with employer plans, at least not to the degree that I'm used to. But all of that being said, I wanted to tell you that a lot of the benefits that are out there that have been created for employers and that are also created for the public sector stem from about 2 or 3 categories, and I'd like to share them with you right now. A, are you chronically ill? Or are you those that only need a physical once a year? Category B, are you a high-end employee? Are you part of the working class, people tied to the public sector or unions? Or are you simply unemployed and having a low income? C, alternative health care. 9 times out of 10, whether it's acupuncture, meditation, or any other kind of yoga or nerve stimulation, is not covered by insurance. Now, it's unfortunate because in many ways we've discovered, especially on this show, that those alternative means are actually preferred means of treatment, especially if you're suffering from emotional chronic illnesses or mental health disorder, or if you're suffering from epilepsy and neurological dysfunction, or if you have issues like prediabetes and trying to prevent it from happening. These are things that alternative medicine actually help. The other things to consider are the fact that there is so much confusion out there, and there will continue to be so much confusion. So hopefully by listening to this show and hashtagging me at Frank About Healthcare, that is the hashtag, Frank About Health. And at the same time, my @ is at Frank Healthcare, so we can communicate together, especially over the next 4 weeks. I'm targeting this show in particular to the employers out there who I've been speaking with, and at the same time to several sponsors I've been talking to that are very much finding this particular program helpful to their business. If you remember, Mark's Marine Pharmacy out of Vancouver, Canada, has told me that they have found a lot more customers through this show, but we're not talking 500 of you, although that's what I would like. 5 or 6 of you, and that's 5 or 6 more than they could ever expect, to be honest with you, because everything's been word of mouth. But ironically, the kinds of requests for medications have been in the following 3 categories: epilepsy and neurological dysfunction, major depressive disorder, and in some cases obsessive compulsive disorder. And for those of you out there suffering from sexual dysfunction, they have affordable Viagra. So for me, in using this show to be able to attract more business, but from the perspective of them providing a higher quality of care than you might be receiving here in the U.S., it is important to understand that while we are looking for more affordable treatments, we are also looking for other places that might not only give you affordability, but also higher quality. So keep in mind, I'm trying to educate you and the employers out there about what's available here, but I want everyone to keep an open mind to still look wherever they're going to get the best quality of health. On today's show, I'm going to have a member of the working class, an individual who's worked for approximately 20 years, 17 to 20 years with the Department of Education in New York City. And I understand from having spoken to him that he is part of an interesting benefits program that the union he's part of offers, but there are lacks based on the kinds of treatment he's needed recently. And I'm going to let him speak in the second break. But the reason why I'm bringing him as an example is this is a person who represents pretty much everything I've said. He suffered an illness when he was a kid and did receive proper treatment, but there was not much affordability in the area of insurance. At the same time, while he is preventing other illnesses from taking place, he does have a good plan, but there are so many lacks because it's for the public worker. He reminds me of a person that needs to get supplemental insurance, and therefore I think what's in his mind is the negotiation between private sector insurance, especially those that are no longer part of the Affordable Care Act, or maintaining union-based insurance, which has other benefits, including pensions. So that's something to be aware of, and if you put yourself in those shoes when he's getting on the air, hopefully you'll learn more about what I've been talking with employee-based insurance. Overall, there is the fact that no matter who I'm speaking to tonight, employer or employee, each of us have something to continue maintaining. It could be our medications, it could be a chronic illness. And that pretty much is around 60 to 65 to 70% of the population. What is unfortunate, I find, is that with the programs that are available today, in some ways, based on the quality of those programs or the quality of the medications in particular, people have to actually prolong their treatment in order to maintain as much quality that they need in order to have stabilization in their life and work. I think these employer-based programs actually provide that kind of support. But again, we do have lives outside of the workplace. So other things to consider as to why companies are giving you the kind of benefits is they want to retain your talent. They want to keep you employed. They want you to be motivated. They want you to be incentivized to work for them. And at the same time, let's face it, every business makes a profit when their brand looks great. So you talented employees out there will be willing to make them look great and profitable, especially when you feel that they're taking care of you. We're going to take a small break, and in the meantime, if you have any questions for me, remember at Frank Healthcare on Twitter, hashtag FrankAboutHealth. Speak to you soon.
You're listening to the Talking Alternative Network.
Hello, I'm JC.
I'm Joan. And welcome to 21st Century Entrepreneur.
We bring education,
insight,
knowledge,
awareness,
trouble,
craziness, and fun
for you, the entrepreneur who's looking to build your business
and your community. Listen every Friday from noon to 1 Eastern on talkradio.nyc. And you can tweet us at 21st CE Radio or Talk Alternative.
Talking Alternative Radio, 24 hours a day.
Hey everybody, I have to tell you something. I must have had an absence of mind. I was so excited to come back to you guys. This is Frank Harrison, Frank About Health, Episode 8. Being frank about employee benefits, in particular healthcare benefits. So for those of you who had a chance to hear my sneak preview discussion, I'm glad you've continued to stay. At the same time, once this is finished streaming, I will be tweeting it out to all of you who haven't had a chance to hear it. But I'm looking to use this episode as a second chapter, if you will, about healthcare. I've used the first two pertaining to illnesses and then pertaining to alternative treatments and actual healthcare research. And now we're looking at solutions to find the best coverage, starting with employee benefits. As I mentioned in my last segment, I have with me in studio today Mr. Jose Dennis, who I'm going to have him speak to you about recent experiences using his healthcare benefits from different sources. I'm going to have him share openly, very casually, as to what his experiences have been with healthcare, in particular specific illnesses, as well as which particular plans have helped him and which did not, and also his viewpoints on what can be made to improve them or actually take or learn from the others that are working. So overall, I wanted to say that this is an opportunity for each of you to ask him questions, even though I'm not taking any calls at the moment. Please, by all means, tweet me any questions, and we will have them answered for you over the next 12 to 24 hours. So, in studio with me right now is Jose Dennis. I've known him for a couple years now. Very good friend of mine who's also been very instrumental with improvisation and doing what I can to have this show off the ground. We've coordinated a lot of the social media push on the show. And he has a unique experience from when he was a kid, but also even more unique experiences surrounding the more recent past with an emergency scare he had. So, Jose, if you don't mind starting out discussing about what is the most hot button issue with healthcare and yourself today.
Well, when I was younger, I was unfortunately involved in an automobile accident, which caused an injury to my head. And at my mid-20s to my mid-30s, I started getting comorbid seizures. And I used to take Dilantin, 400 milligrams of Dilantin, in order to control them, which rarely it did. I was always having seizures everywhere I went and stuff. So, but there was never a solution found to that. And then they stopped. And until this day, I haven't had an issue with seizures or anything like that. I have been to the hospital for a situation that happened to my leg. I had gotten an infection. And I had no problems with the benefits that I received from the union. They were pretty good. They paid for everything and stuff. And the only issue I have with our union benefits is that I have problems with the dental.
Okay, so I wanted to recap a little bit, though. When you had this incident as a kid, and then from your 20s to 30s, you were getting Dilantin, which, by the way, is a very toxic drug for those people who suffer from seizures. Who was paying for that? Was it your family's insurance, or was it insurance from your union?
Well, I started working for the Department of Education in my 30s. During that time, I was out of work, so it was either I had gotten the Medicaid benefits for about a year or two.
Okay.
And they used to help me with that, or out of pocket.
That must have been very expensive. I can't imagine what the cost of that drug was at that time. Do you recall?
No, I don't recall.
Okay. How about the doctors you were seeing to control your seizures? And I guess you saw a neurologist, or you must have seen other kinds of specialists because of your injury. I think you even had surgery done, and you were in a coma, from what you told me.
Yes, I was in a coma for 9 days.
So you must have had other kinds of treatment besides anti-seizure medicine, correct?
Well, yes, they operated on my arm and leg. I have a plate with us, holding my bones together and stuff. And I was in the hospital for 6 months. And
that sounds like to me like a $50,000 bill. But then again, if this was 10, 20 years ago?
Well, yes, I was under the coverage that my mother had at the time.
Okay.
Which was Medicaid, so it covered everything when I was a child.
So that's actually a learning point for myself. I understood that Medicaid is supplemental for the Medicare, at that time, the Medicare recipient, and you had to be at least 62 at that time. In your case, being that you were also already in your 30s, was there a special policy or rider in the Medicaid plan that allowed an independent family member to receive coverage from that plan?
No.
Okay, so that must have been involving a lot of negotiation with the appropriate people to make sure that whole journey that you took was covered.
Yes.
Was it 100% covered, or did you find yourself always racing against time to find ways to pay back the hospital or the doctors or things like that?
Well, it was until I got to work at the Department of Education, which I started receiving health benefits and stuff. Then I was able to go visit doctors and tend to my situation. Before I was slacking, I wouldn't bother because of that.
Interesting.
Because I couldn't afford it.
So that kind of proves my point out there, folks, that it's interesting how not enough coverage, especially for the kind of problem that Jose had, is all determined if you're going to get it because you don't, if you're going to go and follow up on it because you don't have enough financial resources. I mean, that to me still blows my mind. I mean, but I guess the question I would have for you is, did you have any outstanding debt for that bill when you started your job? And was your new job with your new benefits able to pay back those old expenses, or did they just eventually get discharged?
They eventually got discharged.
Okay. That's good, though, but how was that? I mean, I'm just learning here as we go along, because you know Medicare and Medicaid has changed significantly over the last 2 years.
Yes.
So how did that happen?
Well, I just couldn't afford to pay it, so I would just leave it alone.
Wow.
And
did it end up on a credit report somewhere?
most likely.
Interesting, ladies and gentlemen. Keep that in mind. So overall, though, what you learned is that while the Medicaid system was able to help you, especially during that crisis, there was only a certain amount of help that you received.
Exactly.
And what you probably learned from that is being part of a group plan, especially one that was sponsored by your union, gave you not only protection for that illness, which you continued to suffer seizures for the next, 5 years, 7 years after that, when you got the job?
Mm-hmm.
Something like that. Okay, so you at least got that covered, and you were able, who knows, maybe there's a possibility that those seizures stopped because you were finally getting coverage. Now, I mean, it would not be my place to say that, but I could tell you that from taking loads of medicine for things like epilepsy and whatever, when I know that my bills are paid, I feel this sigh of relief and energy level that I don't usually have.
That's true.
So either way, though, what would you say with the Affordable Care Act and other things that have been introduced into the system since that time are the differences from what kind of treatment you had with Medicaid? Do you think you would have had that same type of treatment today if you did not have your protection through your union and you only had Medicaid? Do you think you would have had the same type of coverage?
No.
What would be your opinion as to how it would be?
With the benefits I get now, I have the majority of my health benefits. Everything is covered when I go visit and stuff. The only problem I have, again, is with dental. But other than that, everything is covered, basically.
So then it's also fair to assume that you don't feel the security of ever leaving your job, in the sense that you don't feel you'd have the kind of protection if you were out of your job.
That's correct.
Okay. Another note out there, ladies and gentlemen. The thing is then, tell me, you mentioned something about, what was it, an infection in your leg that you needed to take care of, and your group plan through your union actually took care of it for you?
Yes, that's correct.
All right. 100%?
100%.
No deductible?
No deductible.
Wow. Okay. So then I think you also told me you had an emergency room visit recently. How did that compare with with your current plan?
Well, the place I had gone to, I had to wait a couple of hours to be seen. So I decided to leave.
Mm-hmm.
And since I have a secondary insurance with the private sector, I decided to go to a hospital here in Manhattan, and they took care of me within 15 minutes.
Interesting. Now, I don't want to break any trademarks or rules out there. Would it be safe to say that the private carrier that you got does not represent the unions? That's my first question.
No, it does not.
All right. Would it be safe to say that it is or isn't part of the Affordable Care Act?
No, it's not.
Okay. How did you obtain this insurance?
Pretty much, I got involved with a friend of mine in his business, and He offered it to me, so
As what, a consultant?
as a consultant, yes.
Interesting. So how many hours? 20 hours a week? Something like that?
Yes, 20, 25.
Interesting. Okay, so then you were probably able to do coordination of benefits because your primary carrier is probably with your union and your secondary carrier was with your private sector insurance.
That's correct.
Okay, now in this emergency room visit, how is it that the private carrier was able to help you faster than your union carrier? I'd like to learn more about that.
When I presented my cards to them, they just swiped it and told me everything's taken care of. I mean, I was shocked.
What was the problem you were being treated for?
I had like an aneurysm.
An aneurysm? You mean in your heart?
No.
Gallbladder. Gallbladder attack.
Excuse me.
Okay, all right, ladies and gentlemen, scratch the aneurysm. But the thing is that this was an emergency room visit, and emergency rooms, as far as I know, on all plans are 100% covered, usually. All right, so you would have gotten that 100% benefit on both plans, no matter which one you took care of, right?
Yes.
Okay, but you're saying the main difference there is that you got quick care because you were part of something that is recognized nationally.
That's correct.
Point 3, ladies and gentlemen. Wow, this sounds very interesting because it kind of provides me with evidence to the hypothesis that in order for everyone out there to get adequate coverage and adequate care, A, hopefully you're in an employed situation. B, if you have chronic illness, as Jose had at one point, try to make sure you have secondary coverage. And if Medicare is not feasible, then definitely look for a private carrier. But C, also keep in mind that there are choices to choose from, and don't limit yourself to what people are offering you, as the case with Medicare in the 90s. Medicaid
in the 80s.
In the 80s, okay. Medicaid today, I think you even have to apply and get other kinds of approvals and other kinds of things that would make it like well, either way, ladies and gentlemen, I'm still trying to recover from the information I've heard. We're going to take a break soon. I want everyone out there, any comments on what you've heard of Jose say, please hashtag FrankAboutHealth at Frank Healthcare on Twitter. Speak to you in a bit.
Hi, this is Rob Kay.
And I'm Callie Alpert.
And we're hosts of The Rob and Callie Show. Are you looking for a show that talks about real stuff like life, love, the pursuit of being yourself?
Then you have come to the right place, because we cover topics ranging from chivalry to gratitude to your relationship with money and everything in between.
So listen to us on The Rob and Callie Show, Tuesdays, 8 to 9 o'clock Eastern Standard Time on talkradio.nyc.
Talking Alternative Radio, 24 hours a day.
Hey everybody, segment 3, Frank About Health. Sorry again for not letting you know who I was at the beginning of the show. I'm being frank about employee healthcare benefits on this episode. We've been just speaking with Jose Dennis about 3 instances of using healthcare coverage at the group level for incidences he had in his 20s, his 30s, and recently. Overall, what I've taken away from his conversation is one key point about the Medicaid program, which I also had a chance to confer with some of the other people here in the studio today. In the past, it was a supplement to Medicare and certain demographic groups, whether you were of a certain income level or a certain age group. Today, with the Affordable Care Act, they appear to be 2 different programs, and therefore it kind of explains why that if Jose was in the same situation he was in 20 years ago and didn't have any employment, he'd probably have even a more difficult time finding the coverage that he would have needed for the medications, the hospital stay, and everything else. Overall, though, what I've taken away is that I think it's important, no matter what your issue is, even if you're healthy as a horse, get multiple programs whenever feasible. That would mean primary coverage, secondary coverage, and or the Affordable Care Act. That would be my recommendation. That's actually what I'm doing, ladies and gentlemen, so that's another reason why this episode is advocating it. But as I pointed out, employer health plans have had a lot of recent controversy because it is the next thing being targeted for restructuring based on the Affordable Care Act signed in 2009. However, from what I've seen, speaking to a couple companies the last couple weeks, they're still foolproof in certain respects. They're still giving you treatments that you can no longer have with an individual plan. They're giving you treatments that you cannot find with the Affordable Care Act. So for those of you in jobs right now that you may or may not like, think very carefully about what your employee plan is giving you, because there are certain ways that is an incentive today, especially since most companies are hiring people with that as a perk. That is the first and primary perk. So overall, what are your plans, Jose, with using both your private and your public health insurance at this point, union-based insurance at this point? You mentioned something about dentistry.
Well, my union benefits for dentistry is not that great. That's one of the setbacks that we have with the union, and something we have discussed time and time again. So that's why I have the secondary insurance, which does cover dental. So I'm very happy about that.
So you're going to be seeing a dentist soon using that insurance?
That is correct.
Did anyone over at the insurance company or the dentist tell you how much percentage they would cover? I mean, I guess it depends on if you're going in for a serious root canal or if you're going in for just a regular visit, x-ray and stuff like that.
Let's just say I went to a dental office one time, and when I told them that I had insurance from the union, they laughed at me.
I mean, I can't even imagine what that looked like. When you told them you had the other insurance, what was their reaction?
Well, at that time, I didn't have the other insurance.
Oh, so did you just call them back with the new insurance?
Not yet.
Okay, what do you anticipate will be their reaction?
Hopefully, it'll be different.
Okay.
A different reaction.
A kind of reaction of embarrassment and, oh my God, I'm sorry I didn't ask you. No, it's very interesting. When I myself got secondary insurance from a private carrier, and it covered dental as well. And I noticed that when I went in for the first time, I had seen this dentist for almost 20 years. And when I went in for the first time with this card, all of a sudden, it was a combination of, oh, we can bond your teeth. Oh, we can give you a root canal, $7,000, 60% covered. Oh, we can give you x-rays twice a year. And then after I took the supermarket approach out of the equation, they basically told me that the visits that I truly needed were 100% covered. And that was amazing because prior to that, I was paying $150 for the visit.
Wow.
And that would be normally a copay. And when I finally was able to go and actually take them up on their bonding, I wanted to kind of look a little good here. They covered it. They pretty much told me at first it would be 50%, but they just covered it, the whole thing, 100%. And
That's
now
amazing.
I learned that my insurance company put faith in my dentist. When in the past I was always like, well, wait a minute, it's too much money and I really don't want to go for a tooth pulled or something like that. But it's very interesting how you have that kind of experience ahead of you. I mean, I guess if anything, dental insurance can be something that motivates people to get their teeth checked once a year,
Yes.
as long as it is high quality insurance. Now, therefore, I guess you've also learned you're going to keep both of your plans at this point. You're not going to drop one for the other because of primary or secondary, correct?
That's correct.
What recommendations would you have for people out there who are not sure what they should do, especially during this open enrollment period, whether they're working or whether they're consulting or whether they're going to think about the Affordable Care Act? What would you say?
Well, do your research on the different plans that they have out there, and ask questions. Call your doctors, call people who you see, other people who use the insurance, they know. And they'll give you information on it and stuff, and let you know or help you make
Mhm.
your decision when applying for these insurances.
So basically, when you went and got this private insurance, did you have to notify your union that you were doing this? Was that required?
No,
Okay, because in essence, you were not doing coordination of benefits. You were just using the private insurance to cover what your union insurance was not covering.
that's correct.
All right, interesting. Why do you think the union-based insurance programs are not covering things like dentistry or any of the other critical issues like branded medications or whatever?
I gather it's just too expensive for them to pay.
Well, because they base it on the salaries that I guess they classify you as the working class salaries in the low six figures.
Where I work at, I'm a part-time worker.
Okay.
And our union does provide a pension plan and medical health benefits for us,
Mhm.
which is unheard of in any
For part-time workers, you
for
mean?
part-time workers is unheard of. So
Interesting.
I'm lucky.
No, what is it about the unions in particular that help provide almost a guarantee with coverage, where the private sector, for example, may give you something called COBRA, but after 18 months you're left without it? I mean, why are there more protections?
Well, we fought for these benefits and
Mhm.
stuff, and we've been out there going to visit the senators and stuff like that, and fighting for our rights.
Mhm.
And that's how we've gotten all these
Interesting.
benefits and pension plans and stuff like that. It's been years that we've been doing this.
Wow. I guess it's just, again, how public sector versus private sector is perceived. I mean, I think about it from both sides because I've had a chance to do public sector work before when I was at NYU years ago. But private sector insurance probably covers more because, again, it's the whole issue of trying to retain your talent, especially in companies that value their employees. But it is interesting how public sector workers who are needed, teachers, the law enforcement, nurses, truckers, hotel staff, the union workers, they're very much needed too. In some cases, even more so than the executives at these companies and whatever. The value judgment that's placed, whether it's by our constituents or whether it's by the insurance industry as a whole, I don't really understand how that value is placed. I mean, in your union, are you actively involved to understand what the key motivation is? Is it about being in a position to really support a cause, or is it just about profitability? About saving money, about something like that?
About saving money.
Okay, so then they figure that they give you most protection while they save money and appeasing everyone with the needs that are critical while still not giving high quality care to things that might be considered a luxury like dental.
Correct.
Okay, so ladies and gentlemen, based on that, the takeaway that I hope you guys have achieved is that a lot of insurance in this country today, healthcare insurance, is based on perception of what is important, what is needed, and what is of high quality. Of course, we have the private sector insurance carriers that are concerned about profit margins more than quality of life, and I always qualify it as someone with chronic illness is actually a liability, again, based on personal experience, so it may sound biased. But what I am trying to infuse into all of you out there is, because of issues like Jose's and in some cases like mine, make sure, especially during this upcoming enrollment period over the next 3 months, that you explore all the options that are out there. A lot of people are blindly just re-signing on the dotted line what they had last year. And having seen recently from my own carrier, changes already starting with 25% rate hikes being quoted, I think it's important that everyone out there just literally continue the communication and dialogue between each other. Again, I'm going to probably, think more about other quotes to share with you when we get back from our next break. But at the same time, oh, okay. All right. You know what? I think I found a quote right here that I want all of you to learn. And that has to do with the state of Hawaii. It is the only state in our nation that requires all employees to give benefits to their all employers to give health benefits to their employees whether they want it or not. And I find that interesting. But 7 reasons to take advantage of employee benefits are: 1, it reduces absenteeism; 2, it saves money; 3, it heightens job satisfaction; 4, it boosts employee engagement; 5, it helps employers retain their best employees; 6, it's very convenient; and 7, it sets a good example. So you employers out there, keep doing your best to make sure that as changes in the Affordable Care Act happen over the next 3 months, that you offer high-quality health care, whether it's through, and I can say this freely, Aetna, Empire, Blue Cross Blue Shield, Anthem, Oxford, and I think there's another one out there that people are talking about, Emblem Health. Okay, so overall, I think that everyone out there can further discuss different healthcare benefits with me and other plans that are available out there by tweeting me at Frank Healthcare, #FrankAboutHealth, and we will be back after this break so I can close out the show and give you an update on what's ahead over the next couple weeks.
Are you into comics, movies, and pop culture at large? What about music and TV? Then you're in for a treat. This is Michael Dolce, your host on TalkingAlternative.com. I've been professionally writing comic books, screenplays, and music articles for almost 15 years. Catch my show, Secrets of the Sire, at its new primetime slot, Wednesdays, 8 p.m. Eastern Time, and get the inside scoop on the pop culture universe you love to talk about. For more info, go to secretsofthesire.com.
TalkingAlternative.com.
Hey everybody, thank you for coming for the last segment of today's episode of Frank About Health. Frank About Employee Health Benefits is this particular topic. We've had a chance during the last 45 minutes to hear some quotes as to what they're saying about why companies are giving health coverage of high quality care, especially in the private sector. We've had a chance to hear Jose Dennis's example of living with both private sector insurance as well as union-based insurance. We've had a chance to hear about how there are many changes going on in the insurance industry today in order to accommodate the Affordable Care Act and to really accommodate profit margins for some of those companies. I think personally we can either battle that issue or learn to deal with it, or as I mentioned earlier, try to find other solutions elsewhere, such as pharmacy or other kinds of alternative treatments that you can obtain outside of the country. But I think what I thought I'd do right now to, really summarize the different employee healthcare benefits so that you had an understanding of what the bigger picture is, I thought I would first discuss obviously about the major medical. Now, I mentioned earlier before the break about 3 particular companies that come off my mind: Aetna, Emblem Health, and Anthem. Now, I could tell you that Aetna is currently one of the most in-demand, profitable health carriers out there that services the private sector. They've recently pulled out of the Affordable Care Act, and they no longer service individuals. They service small businesses of at least 2 employees. It's big businesses as high as 10,000 employees. But Aetna in particular has a solid brand and also a solid reputation with major hospitals here in New York, as well as throughout the country. They also offer in-network benefits without deductibles, and that depends upon if your doctor is in their plan, and it turns out most doctors usually are. And I don't believe with the Affordable Care Act out-of-network benefits continue. However, I do know that in the past, if you were seeking mental health care, you had 30 visits that were covered and 3 emergency visits after, I think it was a $3,000 deductible. Personally, I would say that if you have mental health issues, try to do what you can to focus on the alternative treatment you might be using, as well as do what you can to find the right medication at an affordable cost, unless you're lucky enough to have a therapist or a psychiatrist who happens to be in network. Aetna also, on the group level, offers solutions for things like sexual dysfunction, for fertility treatments, for hair reconstruction, for acupuncture in certain cases, especially if you suffered a knee injury or had surgery, an orthopedic surgery in a particular area where acupuncture would help. I do understand that Aetna, in most cases, does not cover branded drugs anymore. That's purely a patent decision on the part of the manufacturer of the particular drug in question. But I believe that depending upon how many doctor's notes or providers that are supporting the major illness you have, you can get some kind of special tier status that will get you some kind of affordable reimbursement on those medications. However, in that particular case where pharmacy drugs continue to be the commodity in all of this, people open up in their company's health savings accounts. Health savings accounts are where a portion of your pre-tax income goes into this account for about a year. You quote-unquote use it or lose it. But if you use it, you're actually getting a tax deduction on your healthcare expense. Why? Because your income that you put into the health savings account was not taxed to begin with. It wasn't withheld. And therefore, by saving it, you're supplementing your health care, like for those medications. And in many cases, not only are they supported by the employer, but they're also backed by an insurance company, probably the insurance company that's taking care of your major health plan. As you heard from Jose, dental coverage is also covered under group plans. I think that in certain cases, like if you had major dental surgery, you'd probably have to pay 50% of it, and usually there are no deductibles. Now, the other thing that I mentioned, or that Jose mentioned, was Emblem Health. I understand Emblem Health to be a union-based plan that is a conglomeration of about 4 other carriers. They were known as GHI, Group Health Incorporated, HIP, Health Insurance Plan, and then there is also Anthem Blue Cross Blue Shield. And, sorry, Jose, did you say there's a 4th one? I think there were 4. Were those the only 3, or was there another one that you'd like to... within the Emblem Health system?
GHI.
Oh, okay. No, I guess it's GHI, HIP, and Anthem. I know that Anthem is part of the Affordable Care Act. You can go into the exchanges and find a Anthem plan much more affordable under the terms of the Affordable Care Act. When the time comes for open enrollment, you would be able to get that plan at either healthcare.gov or your network, depending on your state. I know that New York is newyorkstateofhealth.com. Then, of course, there are those people, as Jose mentioned, that are lucky to get a pension. Pensions in the private sector have been frozen as of 15, 20 years ago. A lot of people get 401ks today or other kinds of special employer match contribution plans. But in the public sector, when you get a pension, you basically continue to get paid on that pension even when you've retired. So that seems to be a way of supplementing your health care, because I guess you also keep your health care benefits as well. Okay, no, that's good to know. So those of you who are working with Emblem Health or working with other union-based plans, just make sure that you've got as much protection as you can before you decide to supplement it with any other cause. With any other means. The other thing that I have discussed with people, but I don't know if it's still really that much advocated, is FSA, flexible spending accounts. Now, I think from the perspective of the funding, they roll over every year, depending on how much you've used. I think you can even take it out if you've chosen not to use it for healthcare and instead choose to use it for another purpose, whether it's simply income or if you decide to invest it in your 401k or something like that. Flexible spending accounts, I don't hear much about anymore. I'm not the expert to determine if they're still actively promoted by organizations, but I can say that other solutions are coming into the marketplace over the next 6 months to a year. So we'll be able to see if FSAs continue to be one of those solutions or if other ones will come out. Overall, I'm an individual who is suffering from multiple disorders, and as such, I have multiple carriers. I'm referring to the network of doctors I see at the medical center that all share my umbrella policy with Aetna. And I'm also talking about those people that I've had to work with in the past to cover my vision care, as well as my medications, which I now actually look abroad for. There are many different options related to healthcare. I would advocate just look at 3 and don't confuse yourself with the rest. 1 is major medical, 2nd is supplemental, and 3rd, the Affordable Care Act. If you're, of course, in the age 62 and above, look for your Medicare Part A, Part B, and Part D. Part D is your prescription refills. Part A is emergency room and hospital stay, and Part B is simply your major medical. Overall, there is just so much out there when it comes to employee health care and healthcare in general, and we are going to see in 2017 even much more fragmentation, which personally startles me. But in order to be as prepared as possible going into the next year, do what you can to shore up on all of the coverage you currently have, supplement with any other kind of insurance you think you may need, including disability insurance or any other kinds of federal programs that you might be benefiting from, especially if you have chronic illnesses like cardiac problems, or if you've suffered from cancer or are dealing with something that's ongoing and God forbid, terminal. But it is important to keep informed, and as Jose said, keep talking to the people that you know who have adequate coverage or who could recommend the best policies to go towards. It's just that one thing that I'm trying to advocate against is just going out there, signing for what you're told to get, and finding yourself with no way of getting the protection when you need it the most. As Jose mentioned about his time in the hospital when he was a kid, I just think to myself, he was fortunate to have his mother's Medicaid plan protect him. But can anyone out there imagine what it would have been like if he was alone, didn't have his mother there, didn't have a job? He would have owed that $50,000, $60,000, $70,000 bill till the day it was discharged. And it just shows there again that health insurance in this country is not only a necessity, but in some ways it's a commodity, and it has to be appreciated as such. And therefore, just like when you invest in your retirement, you have to invest in your health care the same way, even when you feel 100% healthy. So be mindful of that going forward. I would say also to keep informed, there are different websites that you can go into. There's webmd.com. There is realhealth.com. And also, I'm going to tout myself a bit here and say go into frankabouthealth.net, where I'll be posting a lot of blogs over the next few weeks about issues like this and others that come up. And more importantly, keep in mind that healthcare in the United States of America today is an investment in yourself. And there should be no expectation that it's just going to be provided when you need it. You have to work with our government and our officials to make sure you have the most adequate coverage for you, your spouse, and your children. Okay, then. If for those people who unfortunately are not going to get insurance coverage for alternative treatments, be minimal at what it is you do. What I mean by minimal is 1 or 2 of your best options. Acupuncture is usually one of them, and meditation is another. I do find that there are other treatments that people will benefit from, but that really depends on what dysfunction you're taking care of. And being that I'm coming from the neurological point of view, acupuncture works best for me. So any of you out there, if you need the referral, I can send to you. Remember, you can reach me at Frank Healthcare on Twitter, #FrankAboutHealth. Next week, I'm going to cover a specific illness which insurance does and does not benefit, but more importantly, other treatments surrounding it. So stay tuned for that. I'm not going to mention it now, but I hope to hear you guys out there and tweet me and friend me and just keep contact as I continue to expand upon the show. Alrighty. Speak to you next week.
Hello, I'm JC.
I'm Joan, and welcome to 21st Century Entrepreneur.
We bring education,
Insight,
knowledge,
awareness,
trouble
craziness, and fun
for you, the entrepreneur who's looking to build your business
and your community. Listen every Friday from noon to 1 Eastern on talkradio.nyc. And you can tweet us at 21st CE Radio or Talk Alternative.
Hey, all you crazy listeners. Looking to boost your business? Why not advertise on Talking Alternative with very reasonable rates? Interested? Simply email at info@talkingalternative.com.
Are you into comics, movies, and pop culture at large? What about music and TV? Then you're in for a treat. This is Michael Dolce, your host on talkingalternative.com. I've been professionally writing comic books, screenplays, and music articles for almost 15 years. Catch my show, Secrets of the Sire, at its new primetime slot, Wednesdays, 8 p.m. Eastern Time, and get the inside scoop on the pop culture universe you love to talk about. For more info, go to secretsofthesire.com.
You're listening to the Talking Alternative Network at www.talkingalternative.com. Now, broadcasting 24 hours a day. Talking Alternative.
Hi, this is Rob Kay.
And I'm Callie Alpert.
And we're hosts of The Rob and Callie Show. Are you looking for a show that talks about real stuff like life, love, the pursuit of being yourself?
Then you have come to the right place, because we cover topics ranging from chivalry to gratitude to your relationship with money and everything in between.
So listen to us on The Rob and Callie Show, Tuesdays, 8 to 9 o'clock Eastern Standard Time on talkradio.nyc.
Are you a conscious co-creator? Are you on a quest to raise your vibration and your consciousness? I'm Sam Leibowitz, your conscious consultant, and on my show, The Conscious Consultant Hour, Awakening Humanity, we will touch upon all these topics and more. Listen live at our new time on Thursdays at 12 noon Eastern Time. That's The Conscious Consultant Hour, Awakening Humanity, Thursdays 12 noon on talkradio.nyc.
You're listening to the Talking Alternative Network.